I'm here with Dr. Paul Jacob, who is an orthopedic surgeon here in Oklahoma. Doctor, how you doing this morning?
Very good. Thank you for having me on.
My pleasure. Now, I've heard about an incredible uh, um, pain management system that you have here. I mean, I know opiates are very popular in Oklahoma. In fact, some have had some issues with opiates. I'm sure you know.
Yeah.
Why do they continue to be the first line of defense in most hospital surgical settings?
Well, quite simply, most doctors are trained on that method of pain control. And so there isn't much option out there as far as what we can do to manage post-op pain, effectively. And this is really a turning point, I think, for doctors and surgeons in particular, especially here in Oklahoma, where there is abuse issues with narcotic pain medication. Now we have options for pain control aside from just opioid pain medication.
Well, tell us about it, because I hear you have a. Go ahead. I'll let you say. Go ahead.
We have a new medication. It's called Exparel, and really we use it to inject in and around a hip or a knee replacement toward the end of the surgery. And quite simply, it's just a long-acting numbing medication. Instead of getting 6 hours of pain relief, you get up to 96 hours of pain relief. So you can kind of skip that pain crisis that patients get when they're waking up from anesthesia, and keep their pain under control for the first 2 days or so very effectively without narcotic pain medication. And that's really remarkable.
And you have a patient who's actually can tell us about this herself. Janet Burks, are you there?
Yes, sir, I am.
We appreciate you joining us. Tell us about your knee issues.
Well, they started 18 years ago, and with a ski accident, and I just gradually went downhill and all that. And I saw Dr. Jacob in October, and the day we met, I think he can remember it vividly. I was on a crutch, a brace, and crying my eyes out because I was in so much pain. So he scheduled a surgery 10 days later, and I was ready for it. And when I came out of the surgery, I was expecting the pain like I had with my ACL surgeries, but there wasn't any. So I really thought that it was probably the drugs that had me on. Come to find out there wasn't any, and I thought, wow. So I stayed in the hospital 2 days, came home, and managed my pain mainly with Tylenol and an occasional hydrocodone, I believe that's what he gave me, and was able to be up and around within 10 days.
Really?
And just on Tylenol, so ibuprofen. So I feel like the pain management that we went through the first 96 hours really helped me push through that soreness, that pain, that where your brain shuts down and doesn't want to work, and doesn't get your knee to work, to enable me to start the physical therapy the next day and to get going. And I'm very thankful for it.
Now,
and really with that medication, we avoid all the complications associated with narcotic pain medication like confusion, disorientation, delirium, constipation, nausea and vomiting. All that kind of goes by the wayside. So on a patient who has very little pain postoperatively and is not taking narcotic pain medication, they walk the day of their surgery. They get up and start their rehab. They can do that more aggressively. That means they can go home sooner, and they can go home safer.
Now, Janet, you were nervous about going into surgery because you've been through that before, hadn't you?
Yes, I had been through 2 major knee surgeries, ACL total replacement and a bucket tear on the same leg, and Yeah, I was extremely nervous because your downtime is on just those replacements. I mean, on those fixings are about 10 days, 12 days. And then you feel like you can finally get up and do something. However, with this, I was up within 2 hours on my first surgery walking.
Really?
Yes.
2 hours?
Yes.
That's kind of amazing.
Yes. And then with my second surgery, I had to wait 4 hours because the PT had so many patients on the floor. She couldn't get to me, and I kept saying I could do it myself, but they wouldn't let me. So it was kind of it was real amazing to me. I kept thinking that, that this is just wonderful. I can get up walking and not having pain for the first time in my life for 15 years. That excruciating knee pain was awesome. I mean, it was just totally awesome. It is awesome. So.
Now, how long did it take before you got back to your normal routine? Was it as quickly as walking around, or?
Well, I had my first surgery October 13th, 2014.
Mm-hmm.
And I was up. I went to church 10 days later. So I was up and on a crutch in 10 days. Had physical therapy come to my house, which started the very next day. However, they have physical therapy in the hospital, and they were working me. So I was really didn't have that downtime like I did on the previous surgery. Then my left leg was a prime candidate again for a knee surgery, so went ahead and had it December 18th of 2014, just 7 weeks later. And by that 7 weeks, I was walking by myself without a limp. I was not on any pain meds at all, not even ibuprofen by that time.
See, that's amazing.
And I was ready to go for the second one because the first one was such a success.
Absolutely. Now, Dr. Jacob,
I really had to kind of slow her down because she wanted the second one almost immediately. So we had to come to an agreement.
How many people would want? Who's anxious for surgery?
Well,
that's part of the remarkable part of this drug is, this is in particular total knee replacement is remarkably it's just a very painful procedure, and we have never found a good way to get people through that first part in order to make this a tolerable experience. And EXPAREL has really absolutely changed the way that we treat postoperative pain for these patients, and in return you see a total change in their post-op recovery, not just on day 1 or day 2, but at the first time I see them at their 3-week follow-up, their range of motion is better, their strength is better, their attitude is better. They just have a more positive outlook about the whole experience.
So this treatment could really change misconceptions or preconceptions surrounding orthopedic surgery. From what I'm getting here.
Absolutely. Yeah, I absolutely believe that. And for patients who I've had lots of patients who have had surgery prior with either another surgeon or without EXPAREL, and then they have their second procedure, which they may have put off for years because they were so afraid to have to go through what they went through before. They come to see me, they have the procedure with EXPAREL, and I'd love to claim all the credit and say it was something that I do that's remarkable in surgery, but it really is a combination of things that we do very differently today, and a big part of that is the use of EXPAREL.
Now, how can our listeners get more information on this treatment?
So they can go to EXPAREL has a website and a patient portal that they can use. They can go to my website through my group, which is Oklahoma Sports Science and Orthopedics, or OSSO, and they can find my page on there and even email me directly with questions if they'd like. And I'd certainly love for them to call the office at 405-424-5426 and set up an appointment to see me.
Well, we appreciate you talking to us. Janet Burks, who's given a remarkable story. I can't believe you're up and about that quickly after surgery. And orthopedic surgeon Dr. Paul Jacob, thank you so much for taking the time and talking to us today.
Thank you.
Thank you. Appreciate it.